Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner and I'm joined by Dr. Brandon Fuller of East West College of Natural Medicine. Our topic is treating shoulder pain, and right now I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. I'm Russ Badiata, campus president at East West College of Natural Medicine. Did you know that 20% of Americans will suffer from chronic shoulder pain in their lifetime? Unfortunately, approximately 53,000 people in the United States have shoulder replacement every year. Whether you're an athlete or just someone who enjoys gardening, shoulder problems may arise. On today's program, we'll discuss common pathologies of the shoulder and treatment with acupuncture and Oriental medicine.
Thank you for that. So, Dr. Fuller, from 1996 to 2006, shoulder surgeries here in the U.S. alone climbed 600%.
Right.
What do we attribute this to?
Well, first, I mean, 600% is huge.
That's unbelievable.
It's massive.
People
right?
are hurting their shoulder.
They really are. One of the things that we can attribute it to, it's actually a two-part piece. And it's quite interesting because they're polar opposites, right? We have those Americans or the U.S. is becoming more active and they're working out, and we were just talking about baseball and how people are getting more athletic, and so we're seeing more shoulder injuries. People are going out, they're playing sports, they're injuring themselves. On the other hand, we have as a whole in the U.S., we are the most obese out of the entire world.
So does sedentary work against you if your shoulder muscles are not strong, or your arm, and all of a sudden you exert yourself?
Yeah.
Could that put you at risk for a shoulder injury?
It does, definitely. And when if we look back at even the last episode that we shot, and we were talking about obesity in the knee,
right?
Just having some sedentary lifestyle lends itself to more inflammation, more pain in the body, and so we end up with more pain in areas that are more prone to it.
Right.
So more joint pain
and up in the arm.
Correct.
So what percent of the population suffers from shoulder pain?
Generally, it's 80% of the population, and when we think about 80%, we go, wow, that's such a huge amount, right?
It's 4/5.
You go, holy. But when you look at the age range, that's the most interesting piece, because it's ages 18 to 88 are the most common for pain. And you go, wow, that's huge.
So teenagers, like getting out of high school, all the way up until elderly.
Exactly. And so when you look at that, you have to think, okay, out of 18 to 88 and 80%, almost every single person is going to have pain in one way or another throughout their life.
And this can obviously affect lifestyle. It can affect a whole number of things. I mean, being able to carry, just going about your day, dealing with this pain.
Yeah, definitely. You could be walking down the street and slip and hurt your shoulder, or reaching for something.
Car accidents, I'm sure.
Yeah,
certain things.
There's all kinds.
Now, what are some of the most common shoulder pathologies?
Some of the biggest ones that most people might notice or might realize is osteoarthritis. We hear that all the time, especially in the elderly.
So does that cause like a stiffness in the shoulder joint?
There's a stiffness, they have trouble moving, they can't quite lift
constant
like they
pain,
used
or
to.
just in certain?
Generally, most patients will say, I have pain in the morning when I start to get up, as long as I get some movement. If there's some sort of bone spurs that start to grow on that joint, then they might not be able to lift or move like they should.
That can complicate.
Right. Some others would be rotator cuff injuries, or bursitis, or tendinitis, subluxation.
And could rotator cuff injuries, I mean, even the machines at a gym or a fitness center, you could potentially, if you're working the pec deck or something like that.
Definitely.
So now, when we hear about shoulder pain, you hear a lot about, oh, I'm having surgery, and you hear these pitchers, they undergo the surgery for the rotator cuff, and of course spring training starting, that's a common injury, but do all of these necessarily require surgical intervention?
No, not at all, not at all. We have a couple different factors that we look at least when they come in to see us, and the first one being, what is the problem, right? Is it just a bursitis or a little bit of tendonitis? And then we look at how severe is the problem? How do you quantify the pain?
Like range of motion? Do they like do a little test?
Yeah, we'll do orthopedic evaluations. Can you move your shoulder for me? A little bit of range of motion.
And even like maybe a lifting exercise if it's uncomfortable, or not necessarily?
Not always, because we don't want to injure anything more.
You
right?
don't want to further complicate the matter.
Exactly, exactly. So we'll look at how severe is the pain, and then we'll go to the next part, which is it acute or is it a chronic problem? Is it something that happened just yesterday? You rolled out of bed and you went, "Ooh, wow, something just clicked or popped."
Now, I don't know if you know the answer to this, but is it often the dominant hand or the dominant arm of the person that gets injured more because they're using it, or sometimes in some cases both shoulders affected, or?
I would at least say, in my opinion, and what I've seen in my practice, I would say it's the more dominant hand, right? More and more people, you'll see them, they'll always reach with their dominant hand or their strong hand.
So that it could be more prone to an injury just because you use it more for basic tasks.
Yes, yeah, definitely. And to continue on to with those pieces that we always look at, the last piece ends up always being age of a patient, right? And that's a big thing that we always want to look at with our patients is are they young enough, are they healthy enough, are they stable enough to go through any type of surgery?
Yes, surgery, and even if they do, there would be a reason to go and see your practice.
Exactly.
And kind of work both remedies or techniques into their recovery.
Definitely, definitely.
All right, well, don't go away. When we come back, more questions with Dr. Fuller, and then we'll send it out to the college to see a demonstration up close.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. We're talking about treating shoulder pain. And Dr. Fuller, we were talking about some of these shoulder injuries. So of all the ones we've discussed, which ones are the most common, or which one is the most common?
Generally, rotator cuff tears or injuries are the most common, and that's about out of that 80% that we were talking about.
Now, is that a ligament, or when I see here rotator cuff, I mean, you hear all the ligaments that are in the knee, but the shoulder, how does that all fit together? I mean, we see it here, we just see the muscle, but we don't see the inside.
Right. So the shoulder, the rotator cuff, is actually made of 4 muscles, right? And we acronymed it called SITS, S-I-T-S. And it's the supraspinatus, infraspinatus, teres minor, and the subscapularis muscles. And they all kind of work in the back here and the front to help hold that shoulder all in place and help it move the way.
And when that gets compromised, therein lies the injury?
Right, exactly. And so a tear to to one of these muscles can really impede any quality of life that we might be looking at. So reaching up, washing hair.
Now, is the shoulder joint itself inside there, does that ever get injured, connecting to bone, or?
It does. Generally, you'll see more like dislocations or breaks of some sort. If somebody lands funny, they can actually break their humerus.
Yeah, I've heard of a broken arm, even the upper arm, but a broken shoulder is that physically possible?
It is possible. It's a little more tricky than that, I think, right? Because it's not a true ball and socket joint. It's kind of like a semi ball and socket joint. So there's more of a likelihood of a dislocation than like a break.
So it flies out. And if there is a dislocation, can they come to the college to get that? Do you set those, or what happens?
We do not set those, but what we can do is evaluate it. If you think that
it might be out of socket.
You generally, our recommendation is going to be, if you feel like it's out of socket and you're not 100% sure, go to the hospital first. Go to the emergency room, get X-rays, MRIs,
or an urgent care. Make sure.
They can do more with that than we as acupuncturists would be able to do. But if it's one of those things where you go, I'm not sure if it is. There's no real different look to it.
It's not swollen.
It's not swollen. You can come on in, and we'd be more than happy to take a look.
Now, you mentioned acupuncture. Can this be treated with acupuncture in some cases, these injuries?
Oh, definitely. Acupuncture can help in 50% of the rotator cuff tears that are minor, those rotator cuff injuries. 50% of them don't necessarily need surgery. So we can treat injuries of the shoulder with acupuncture, reducing inflammation.
What about a bruised shoulder? Let's say you bump into something, but the rotator cuff, you could potentially treat.
You could bruise a muscle, something like that, and all that acupuncture will do is bring a healthy blood flow to the area and help reduce inflammation.
Keep that channel working in your body and getting things back on the right network, if you will.
Yeah, definitely.
Now, what are some of the common issues you may see at your clinic at the college when it comes to this?
Some of the common issues generally are one of our major ones is that rotator cuff injury. And then after that, we look at things like arthritis, and we look at bursitis and tendonitis.
Now, what is bursitis?
Bursitis is a inflammation. There's what's called a bursa, and there's little sacs in between our joints.
In the front part of the shoulder or the back?
It's actually in all our joints.
Okay.
We have all these little fluid-filled sacs, and it's so that we're not just smacking bone on bone together.
So that potentially gets infected or dried out or herniated?
It gets inflamed.
Inflamed.
Yeah. So when it becomes inflamed, it's kind of like it's like having a really big water balloon in between your joint.
Right.
Your joint just doesn't want to move the way that it's supposed to, right? Whereas if it's
the normal size, that way you're able to.
Then you can move. But imagine a overfilled water balloon, and you're trying to move a ball and socket in between.
Yeah, that can be very challenging, I'm sure, possibly painful.
Exactly, very painful.
Now, you say tendonitis up in the shoulder. Is that an issue? I often hear of that, like down in the wrist or the arm, but.
Occasionally it is. Generally we see it in more athletes, like baseball players or weightlifters, even power lifters will have different tendonitis in different areas.
Now, when we talk about physical fitness, are there ways to prevent some of these injuries? Do you recommend to patients, maybe hitting the rowing machine to work the rear deltoid muscle and things like that?
I would say yes. If you're worried about injuring your shoulder, you might want to do extra stretching in that area, the more you stretch, and then doing exercises for the shoulder to help build the muscles, but making sure that stretching's in place, right? If your muscles are too tight and you throw wrong or you shoot wrong, something like that, it can damage the muscle.
Great conversation. So now let's go out to the East West College of Natural Medicine and see a treatment demonstration with Dr. Stephen Wrench.
Thank you, Grant. Hello, I'm Dr. Stephen Wrench, and we're at East West College of Natural Medicine in Sarasota. Our patient today is Wyatt. Wyatt presented with shoulder pain, worse with movement, painful upon palpation on certain areas. Now, before we went on camera, I did a series of orthopedic evaluations to try and decide what we're looking at, or is it something we might even want to refer out. So we checked him for common rotator cuff pathologies. We checked him for what we call a Bankart's lesion, a slap tear, a torn labrum. We checked him for things that might indicate an inhibited blood flow, as in thoracic outlet syndrome, what we call a neurovascular compromise. And most of that came out negative. So we have no reasons to suspect it's anything other than just normal wear and tear. But here's the rub. This is the most complex joint in a human body. It has the greatest range of motion. It has one joint, the glenohumeral joint, three specific articulations. The acromioclavicular articulation, where the collarbone articulates with the acromion process. Then what's called the sternoclavicular articulation, where the clavicle articulates with the sternum. And back here in the back, you have the scapulothoracic, where the shoulder blade, if you will, or the scapula actually has to articulate with the rib cage. It has 8 specific bursa. It mimics a ball and socket, but technically it isn't a true ball and socket. Because of its semi-lunar fossa, it has a little half-moon shape. This is the head of the humerus, and it articulates this way. The real ball and socket in our body, of course, is our hip, which has what we call a deep acetabular socket. This one isn't quite as deep, which is why we have this incredible range of motion that we have. Now, the most common injury to the shoulder is pretty much a rotator cuff. What happens a lot with patients is they'll self-diagnose because their buddy will tell them that's what he had, and they'll often say, yep, that's what I got. So we advise that you get a proper workup of the shoulder before you just self-diagnose or assume what you have. Maybe something worse, maybe something a whole lot less. So today, we're going to swab some points on Wyatt's shoulder that we know have a positive effect on treating the shoulder. And I'll give them names and numbers. It won't mean a lot unless you're into this medicine a bit. But there's 2 little points here, one on the anterior shoulder where the anterior deltoid and medial deltoid connect, or divide, I should say, and one on the posterior where the medial deltoid and posterior deltoid heads overlap. And so we're going to treat those, and then we're going to do another point here on the hand and the elbow. And this is called large intestine 4. The large intestine channel has a tremendous effect on the arm and the shoulder as a whole. So we're just going to keep this a real simple treatment. At the end of that time, I'm going to do a little injection with a substance we've used in other shows that we call Traumeel. Traumeel is an anti-inflammatory, and it's an analgesic. So it's a natural painkiller. It doesn't present in the body like something that's foreign, like a pharmaceutical that's introduced into the body and may have a harmful side effect. This won't have any of that at all. So we're going to select our acupuncture needles, which, by the way, are so fine you can tie them in knots. And literally, we do this frequently. And here's our point. We make a little tap, and we just insert this needle into this point. And there it is. And then we'll go to a neighboring point. Again, we know these have very, very powerful and profound effects on the shoulder. I'll do one more point here in the front. It's an extra point. And this will be a point that's called Janshan, and this has a great effect on the anterior. Excuse my reach around you here for 1 second. And there we go. And then one more. And we'll be through with this area that we're working on the shoulder here. And so now we're going to go over here and do our little large intestine 4 point. And I think I can hit that from right here in front of you. How are you feeling so far? Totally relax your hand for me there, Wyatt. There you go. If a patient tenses up a little bit, you're pushing a needle into a muscle that's taut. Did you get a little reaction? Okay, so that's not uncommon. In fact, that's a very positive sign. As we talked about earlier, sometimes when energy flows through the body, we call it our channels, our little superhighway system. When it stops, the channel itself becomes blocked, much in a way if you took a garden hose, tied it in a knot, and then turned the water on at the spigot. The pressure builds up at the blockage. So when a patient gets a little reaction like he just got, and you said it felt like electricity? Okay, that's a good sign, because if you had a blockage, it's pretty safe to assume you don't have one now. And so that's what we would do. Those are the points we've selected. And we let the patient sit here for probably about 15 to 20 minutes, then remove the needles. Then we would put a nice liniment afterwards. But first, I'm going to remove the needles, and when we come back, I'm going to give him a little injection at specific points with our homeopathic remedy. Okay, and we're back, and now we're going to do the injection that we talked about here in Wyatt's shoulder. We're going to use a homeopathic substance we talked about before, Traumeel, anti-inflammatory, analgesic, anti-edematous. So we're going to swab a couple of points here that we've pre-selected because we know of their efficacy, and then one here. So this, the sooner we get the serum into the muscle, the sooner he can kind of take the treatment home with him. So, all righty then. 1, 2, 3, a little tap. Did you feel me tapping you?
I felt you tapping me, yeah.
Okay. Try to do that to kind of confuse the little sight receptors there. And we got one little one back here in the back. We're going to do this one also. And then we have one more that we've used here that we know has a profound effect on the upper arm and the shoulder and into the scapula as well. So this patient should be feeling better in no time at all. And that's all there is to it. And now we'll go back to the studio and back to you, Grant.
All right, we saw Dr. Wrench giving that demonstration. He did a couple of techniques there.
He did. So there was acupuncture there, which is a great technique that he was using for any type of shoulder pain, no matter what the patient's
Running the
problem
gamut,
is.
whether it's chronic, whether it's
Exactly.
a sharp pain that you got with an injury.
Right. And then what we saw was he did the acupuncture, and then he was adding injections in there of homeopathics to help with any type of shoulder pain. And generally when we do that, it's quite interesting. We mix what's called Traumeel and Zeal. And these two homeopathics combined will deal with any bone problems, but any acute traumas as well.
So it really can help the patient get back to normal, to using that shoulder. Now, are these repeated? Should folks, depending, I guess, on how severe it is, but you would come back for these acupunctures?
You would. Generally, we say we start with, let's see how you do in 4 treatments. So we start you off in a 4 treatment block, and then if we see improvement but there's still a little bit of pain left over, we'll continue with another 4. Sometimes patients will get better on like the 5th treatment, and they go, I don't have any pain.
I feel pretty
anymore.
good, so then maybe you
and
back
then
them
we
off.
say, okay, why don't you just give us a call when you need to come back in, or if you need to come back in.
All right, Dr. Fuller, stay right there. We're coming right back with more.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Hi, I'm Nancy O'Neill. What's happening on the Suncoast? Join us Fridays at 9:30 a.m. and 8 p.m. on Suncoast FYI to hear from local businesses and nonprofits to get the scoop. You won't want to miss it.
Welcome back. We've been discussing shoulder pain and treatments. Dr. Fuller, I want to continue the conversation now. So what is the approximate cost of shoulder surgery? I imagine it's pretty expensive.
It is, and it varies depending on the situation. So when we were researching to try and figure out and nail down a specific number, and what we found is that depending on which operation you get, it can range from $6,000 to $53,000.
So if you don't have health insurance, obviously coming out of pocket could be a lot.
It could be, yes. It could be a huge amount of money, and not everybody can afford that.
Yes. So obviously the alternative treatment is to come to the college and to the clinic to look at that. Now, Americans have more shoulder surgeries than anybody else in the world. Why do you think that is?
I think it relates to that that sedentary lifestyle factor. You know, if we're not exercising and getting blood flow to different areas and regions of our
pretty
body,
much if you don't use it, you lose it.
You lose it. Right, exactly. As stress, even though we don't like stress and we don't like that word of stress, but some minimal stress on the body is actually a good thing.
Now we hear hip replacement, knee replacement. Is there such thing as shoulder replacement surgery?
There are shoulder replacement surgeries, and they have two different types. They have one that's like a half replacement, and then they have a whole replacement. And generally, the half or the partial replacement is what a lot of people will end up having.
Any idea on how many of those are done each year in the U.S.?
Unfortunately, no. But I know that with the full replacement, we do see quite a significant number. We're just not 100% sure. We were looking,
right.
Couldn't find.
I'm sure. Like we talk about how many shoulder surgeries in general. I'm sure that it's on the high side.
Yeah.
Now, if a patient comes to you and says that the doctors are saying that the shoulder is bone on bone, can you still treat or do something? What happens then?
Well, the first thing that Dr. Wrench and I always do with a patient that walks in and says, you know, it's bone on bone, my doctor says I gotta have surgery. We talk to the patient and we go through those 4 steps. You know, what is it, how severe is it, what the problem is, what's their age, and we talk to them. We always leave it up to the patient. It always needs to be the patient's decision. If the patient says, you know what, I'm going to have the surgery, we say, that's fine. That's not a problem. Come back to us and we can help you with the rehab afterwards.
Right.
One of the great things about East West College is that we work in conjunction with Health South, and we have externships. So our students go to Health South Rehabilitation Hospital. So patients who have this shoulder surgery and are in the rehab at Health South can get acupuncture there also.
So if somebody wants to know more about treating shoulder pain using Oriental medicine, where do you tell them to go?
I tell them to go to East West College. We're on the North Tamiami Trail right across from Smuggler's Cove.
Right in Sarasota?
It is, right in Sarasota. It's actually on the north end, closer to University.
All right, and then the website and the phone number?
The websites should be on the screen, and it's 355-9080.
Great discussion, Dr. Fuller, and thanks for joining us. We'll see you next time.